Good afternoon. I am Dr. Marie Philip Neri. I'm a nephrologist in the Department of Internal Medicine at St. Louis University School of Medicine. As we begin, I would like to introduce my co-presenter, Dr. Tejasvi Pooja. Dr. Pooja is a second-year nephrology fellow at St. Louis University School of Medicine. This micro-webinar series is intended to introduce fellows and new practitioners to the core concepts of infection prevention and patient safety in dialysis clinics. This is the third in a series of 3 micro-webinars. The first addresses incorporating infection prevention in routine roundings. The second webinar focuses on water systems and considerations for infection prevention. Dr. Pooja, congratulations on becoming a senior fellow this year. I understand you're planning to join a group practice after completing fellowship next year.
Yes, Dr. Philip Neri, I plan to see patients at 2 outpatient dialysis units. After 1 year, I'm hoping to become a medical director at one of the facilities. I'm here to learn and share more information about infection prevention and control practices and my responsibilities as a medical director.
During your in-hospital nephrology consult rotations, you may recall seeing many dialysis patients with serious infections and even deaths from complications.
Unfortunately, yes. Today, I would like to learn how best to prevent infections at outpatient dialysis, reduce hospitalizations, and prevent adverse outcomes, including deaths. When I admit a patient to the outpatient dialysis, how can I and my colleagues ensure effective infection control practices will be implemented and the patient will be safe? Here are the objectives for this season. What should we do to prevent infections as a new nephrologist and later as a medical director? How can we help the patients and dialysis team prevent infections? Where do we find helpful resources and tools? Let's get started.
When you walk into a dialysis facility, make sure you know the basics of infection prevention and control. Adhere to best practices, which we will address on the next slide. Learn about each facility and get involved and be an effective leader. We will address these points in more detail shortly. You are bringing in enormous knowledge and experience from your fellowship, and please make sure to take them with you and update as you seek new information.
Several national bodies are helpful, and we would like to walk you through a few key sites. CDC has a very helpful section dedicated to dialysis safety. There are infection prevention tools, guidelines, recommendations, and resources for dialysis providers and patients. There are also resources to provide staff education and perform competency evaluation. CDC's core interventions have been proven to reduce dialysis bloodstream infections.
The Making Dialysis Safer for Patients Coalition is a partnership of organizations and individuals that have joined forces with a common goal of promoting the use of CDC's core interventions and resources to prevent dialysis bloodstream infections. The coalition provides periodic webinars, access to infection prevention materials, audit tools, and opportunities to network with other partners. It is easy to join the coalition by just going to their webpage and clicking Join Now. Nephrologists Transforming Dialysis Safety is one of ASN's projects. NTD's mission is to enhance the quality of life for people with kidney failure by engaging nephrologists as team leaders in transformational change that continuously improves the safety of life-sustaining dialysis. Under the Resources tab, there are several helpful links and documents related to infection prevention and control. There are also online learning modules. For example, the module titled "A Curriculum to Achieve Zero Preventable Infections" was especially developed for fellows and new nephrologists. Another helpful resource is the state-based healthcare-associated infection prevention activities. Background information is available on CDC's website. You can also visit the individual state programs.
Finally, don't forget to enhance your knowledge by keeping up with recent publications and guidelines and related conferences and committee memberships.
Having the knowledge alone is not enough, but we need to set the example for our dialysis staff and patients.
Proper hand hygiene is critical when entering and leaving the dialysis facility and in between patients. When you're washing hands, make sure to use a clean sink. The sinks should be clearly marked as clean and dirty. Wear appropriate PPE as indicated. The CDC has dialysis-specific resources for cleaning and disinfecting as well. Examples include an audit tool, a checklist, and information for managers on selecting the proper disinfectant and establishing a procedure, ensuring that staff are trained, and providing proper access to supplies.
Next, it is important to learn about each dialysis facility.
Try to meet the dialysis facility leaders, medical director, clinical manager, charge nurse early. Get to know your dialysis team that includes nurses, patient care technicians, dietitian, social worker, and clinic administrators.
Active participation in the monthly quality assessment and performance improvement, also known as QI meetings, is generally very helpful in learning more about dialysis facility, learning quality improvement skills, improving patient outcomes, and developing leadership skills. There are many sources of dialysis facility data as listed here. It is helpful for nephrology providers and a necessity for medical directors to become familiar with the key sources, such as monthly QI minutes, past CMS or state survey findings, self-audit results, National Healthcare Safety Network reports, dialysis facility policy and procedures, and communication with other healthcare systems, such as hospitals and outside laboratories, to capture culture results, reasons for hospitalizations, etc.
Nurturing culture of safety at a dialysis facility is crucial, though challenging. We as future nephrology leaders can make a difference.
We need to establish safety as a key goal for the facility, evaluate errors as potential system failures rather than blaming one or more individuals, develop processes for root cause analysis, which is a critical step in the quality improvement process, engage the dialysis team in developing action plan, and commit needed resources such as time and technology.
Dialysis patients and their care partners are crucial members of the dialysis team. Educating patients and their care partners on the best practices is important in achieving optimal outcomes in infection control and prevention practices. There are helpful resources, including posters, handouts, and videos available on the CDC's website.
The Centers for Medicare and Medicaid Services regulates dialysis practices and has specific requirements known as the conditions for coverage for ESRD facilities. The details can be found in this final rule, and we encourage you to read this document. Outpatient dialysis facilities are regularly surveyed by CMS for initial and subsequent certifications. In fact, dialysis facilities can be surveyed anytime in response to any safety concerns or complaints. In addition to knowing the best practices, we need to be familiar with the CMS requirements. CDC's Infection Prevention and Control Assessment Tool for Hemodialysis Facilities, also known as ICAR tool, was developed by CDC to assist health departments in assessing infection prevention practices and guide quality improvement activities in dialysis facilities, and can also be used by the facilities to conduct internal quality improvement audits and address identified gaps. Dialysis facilities may also use this tool to be better prepared for a CMS survey or a health department visit. An overview of the iCard tool is provided under 4 sections as shown here. There are multiple elements under each section, and you can click the link provided to access the entire document.
Here is an example of one of the elements assessed. Are there signs posted in patient areas within the facility that encourages patients to take an active role in and express their concerns about facility infection control practices? The response is recorded as yes or no, and visual confirmation is suggested.
Section 4 of the iCard tool lists infection control guidelines and additional resources. Make sure to check out the highlighted links to learn more about these valuable resources. Remember to review the assessment results as a team and implement necessary action plans to mitigate any gaps. Several infection prevention and control audit tools and checklists are also available on CDC's website. We encourage regular use of these tools for internal quality improvement and address the findings as a team at the QI meetings. Catheter reduction is an important component of any dialysis infection and control program. A robust interdisciplinary team effort, strong support from dialysis facility leaders, and diligent medical director oversight of all infection prevention and control activities are crucial in achieving optimal hemodialysis outcome.
Here is an example of an audit tool and checklist for AV fistula or graft cannulation. Based on the findings, dialysis team should develop an action plan to improve infection prevention and control practices at the facility.
Medical directors have extra roles and responsibilities. Every medical director is responsible for oversight of all infection prevention and control practices, catheter reduction efforts, and achieving optimal patient outcomes at their dialysis facilities. The details can be found in this final rule. Dr. Pooja, as you begin your outpatient dialysis practice and in anticipation of a future medical director role, I'm so glad we had a chance to discuss this important topic and share with our colleagues today.
Dr. Philip Neri, after today's discussion, I have a better understanding of the infection prevention and control practices at outpatient dialysis facilities, my role as a nephrologist, and critical responsibilities as a future medical director. Thank you, and I'm confident my colleagues will find this webinar timely and very helpful.
I would like to thank my co-presenter, Dr. Pooja, for joining me to share this invaluable information with you. We hope you will click on the links to attend the remaining 2 sections in this micro webinar series. If you have additional questions, please contact ASN. On behalf of the American Society of Nephrology and our presenters, thank you for attending this webinar. Have a wonderful day.